Lenticule extracting hydrocannula for smile refractive surgery.
The authors have no financial disclosure to make. Ever since the existence of human life, our aim as a united community has been to make things easier, and in order to do that, one has to constantly innovate. What is innovation? Innovation is the art, science, or process of developing better solutions from existing inventions and ideas. It is the validation and exploration of ideas that others may have missed, rejected, or long forgotten. Innovation connects the dots. Similar innovations have led the evolution of refractive surgery from radial keratotomy to PRK and microkeratome to now the latest on the block, SMILE. In SMILE surgery, the lower interface of the intrastromal lenticule is created with the help of the laser, followed by the upper interface of the lenticule known as the cap. Finally, a 2 to 3 mm tunnel incision, usually superiotemporal, is made to link the cap interface to the corneal surface. This is followed by lenticule separation with the help of a dissector and extraction of the lenticule with a pair of microforceps. Here, we demonstrate the separation of the lenticule and its extraction by pulling it out with the help of a microforceps. But not every ride is as smooth and easy. If one is not careful, we never quite know when it ends up in disaster. If we take a look at this particular case, there is a marked resistance in the separation of the lenticule, which leads to a tear of the hinge in the tunnel incision. This resulted due to improper dissection followed by a tugging movement to retrieve the lenticule. Such complications are not uncommon. Going through the review of literature, there are multiple highly cited papers published in index journals showing lenticule extraction related complications making up for a majority of the total complications of SMILE surgery. This paper reports the complications of SMILE procedure with the study comprising 160 eyes and showing a complication in 43 eyes. A cap rupture during dissection was the most common complication in as many as 16.2% of the cases reported. So where did the idea originate? One day, I had a severe earache and I went to my ENT friend for a checkup. He told me that wax is the culprit for the earache and removed it by irrigating my ear cavity and not pulling it out, which got me thinking. If the ENT can do it, then why not use it in ophthalmology? So I took this idea to my mentor, Dr. Gaurav Luthra, and we developed a hydrocannula to extract the lenticule, making SMILE surgery further less invasive and extracting the complete lenticule without any cuts and tears. The hydrocannula is of 23 gauge and it bends to facilitate its movement over the contour of the cornea. The curvature of the cornea was taken into consideration while designing the cannula, and we have been using it for over 12 months now. We have done successful extraction of the lenticules in 196 eyes over this period. Here are a few demonstrations which show how a simple idea can make a huge difference in the reduction of complications in SMILE surgery. Once the proper dissection of the floor and the cap of the lenticule is done, the hydrocannula is introduced and the saline is injected, which aids in smooth retrieval of the lenticule. This lenticule is now placed on the cornea to show the intact edges of the lenticule. Another example of the same technique, which is simple and reproducible, leading to the extraction of the lenticule in totality without any cuts or tears. Let us further examine how this works. So we commence the injection. The purpose of slow injection is to promote free flow. Now, why is this important? To make this technique work, you have to localize pressure differential between the inside and outside. If you have anything blocking the entry side around the hydrocannula, you will get a closed space. The pressure throughout the volume will be uniform. you get lamellar flow coming out of the end of the hydrocannula, and that actually is going to generate reduced pressure inside versus outside. You can understand this if you think about the way an airplane wing generates lift. According to the Bernoulli's principle, the pressure is lowest where the fluid flow is fastest in lamellar flow conditions. In case we do not do a slow injection, a situation like this might come up. But here, the advantage one has is that there is good visualization of the lenticule and we know the correct vector forces to be applied to remove this lenticule with the help of a forceps. Once we have understood the dynamics of the procedure, it brings us to our next question, which is, why is this lenticule so important? Over time, we have realized what the true potential of human tissue is. An artificially made clone of the human tissue will never be able to replicate what we can achieve by using an original human tissue. Way back in 2014, we started cryopreserving the smile lenticule for possible potential use in human subjects. And less than half a decade later, we started using it in construction of corneal stroma, therapeutic keratoplasty, keratoconus, and most recently in regenerative therapy. Who knows what the future holds and what new uses of the lenticule might come up in due course of time, just like the amniotic membrane and the stem cells, which have progressed leaps and bounds in human evolution, thus making it imperative that we retrieve each lenticule in totality without any tears and cuts, and we store it for possible future use, hence making our innovation extremely important and one that could possibly help many individuals for restoration of sight, leading us to call this lenticule my precious.